back in 2016, we brought you the story of the 100,000 Genome Project, a pioneering DNA sequencing project. Back then, it had just started helping give diagnoses to children with rare genetic disorders. And we spoke to their chief scientist, who told us how the work was helping them to spot diseases so rare they didn't even have a name. The developers of this technology say this could one day be a go-to test for newborns, helping spot rare genetic diseases, and eventually everyone would have their genomes read. Now the project has finally sequenced its 100,000th genome. As a result of that research, as I said, babies could be given a new DNA test after birth, which could help millions avoid deadly diseases. Well, Genomics England's Professor Mark Caulfield is here, 3 years and 100,000 sequenced genomes later. Well done.
Thank you very much.
Congratulations.
It's a huge achievement for this nation.
It's massive. Go on, sorry, go on.
Well, I was just going to say that it's an amazing achievement. We're leading the world in this field. Thanks to this major government project, we've transformed the National Health Service provision for genomics with a new genomic medicine service, which means there'll be equitable access to genomic testing of all types for 55 million people as a result of this programme.
What does that mean in practical terms? For people watching right now, what does it mean for them?
So today, if you have a rare inherited disease or a cancer, it will be possible to get an appropriate test of the genome for that condition. And that in rare disease may give people an answer for why they're like they are. And that's what, above all, the participants in our programme have told us they crave. We have participants in the programme who've been 30 years without an answer for why they're like they are. In cancer, it can help us choose the treatment targeted to that individual's tumour. And about half the patients that we sequence, we see something that could offer them a clinical trial opportunity in cancer, or maybe even a treatment on the National Health Service. And in 1 in 4 of the people who've enrolled with rare disease, we're able to return a potential diagnosis to them that will be an important moment for them. And in some, not many, but some, that could pave the way for treatment.
Okay. I want to ask you specifically about babies potentially being routinely tested for all sorts of diseases as a result of what you and your colleagues have achieved. Is that likely to happen?
So this would require a major research programme. Currently at birth, we test all babies where mum and dad give consent with a heel prick test, and that allows us to identify 9 conditions that can be problematic in early life, and you can possibly avoid harm. There is some evidence that there might be about 100 or 142 different conditions that you could, if you knew about them, take some sort of action. Now that might mean you are entirely well, but it might reduce disability, it might avoid some harm, and in some children, such as ones we've got in the programme, it has avoided possible death. So we have at least one child in the programme whose elder brother sadly died after 4 months in the ITU, from birth to 4 months, never left the ITU, right. And that child
did you know why? Did people know why?
So he had clear infection and also nervous system changes, but nobody knew what the problem was, and routine testing didn't show anything. So what we found is that when he died, his mum and dad asked us to enrol them in the programme. We tested him, found that he had a defect of a vitamin transporter that you and I have probably eaten in the last 24 hours, vitamin B12. Simple thing. And so when his second brother was born, he was tested and sadly was also affected. And so because cases had had high dose injections of vitamin B12, we put that in the report, and that's what was done on a weekly basis, and that child has been okay and avoided that.
Wow.
So this is not for the many, it's probably for some,
yes.
Only some.
But so we are absolutely not talking about potentially one day routinely testing babies for all sorts of diseases using the information that you and your colleagues have gathered over the last 3 years, so that parents are going, oh my gosh, when my kid is 25, they're going to have some kind of cancer. It's not that.
Well, it's possible that in the future that will be the case. What we brought live is a service focused on rare disease and cancer.
Understood.
But it is the moment for us to ask as a nation and as a world, if we could find out about things that would harm you in early life, possibly also in middle life and later life, should we do a research question? Well, that's an important thing. So that's why, if we were going to consider doing this, this would need to involve a major societal and public debate, and it could only be done on the basis of informed consent. Now, if you imagine that the genome is a blueprint you have for your life, just because you've actually measured the genome, it doesn't mean to say you have to tell everybody about the risks immediately. So in routine guidelines from British Society of Genetic Medicine, we don't tell children about adult diseases if there's no chance that they will affect them in childhood. But it might be reasonable to imagine that the genome is a measurement that can keep on giving you answers for things you could possibly avoid over your life.
Okay.
So it's the moment to ask the question, should we test this as a research question? And then we would need to examine the affordability of this across the population.
Okay. Well, thank you so much for telling our audience about it. An incredible achievement.
Thank you very much for having me.
Thank you.
Thank you.